What is the most overlooked aspect of diabetes or endocrine disease?
Every single patient is unique.
You hold two PhDs and two MDs and a PhDs, right? What inspired you to go that far?
I was amazed by understanding how body works.
What are the lifestyle changes an average person can make to, prevent these diseases themselves?
Things people can do to prevent and to help treating their diseases, like diabetes.
About myth, the misinformation. So, what's one common myth about food or hormones or metabolism you wish people would not believe?
Important of that. People with diabetes cannot eat sweets.
Welcome back to Medical Centric, everyone. Today we are joined by someone truly extraordinary in her field. Dr. Monalisa Azivado is not just an endocrinologist, she's a powerhouse of knowledge with two MDs, a PhD, and an international research experience at the NIH in the United States. For over 20 years, she's turned future doctors, published groundbreaking research on hormones, genetics, and diabetes, and dedicated her practice to helping people prevent and manage metabolic diseases. She embodies the perfect blend of clinical research and teacher, and today we have the privilege to learn directly from her. Dr. Azivado, thank you for doing this. How are you?
Oh, I'm good. Hello. For me, it's a pleasure to be here with you today. And let's talk and interact.
Absolutely. The pleasure is all ours. I'm very excited. You're the first non American that we're interviewing today. So that's fun. Usually I think it's not because there are more doctors in America. I think doctors in America are more active. So it's more easy to contact them, and like doctors in other countries are maybe not that much on social media. But you have a lot of social media presence. You post a lot on Instagram. What inspired you to take your medical expertise online?
Well, I let me try to answer this question from the beginning. Before thinking of being a doctor, when I was a kid, I used to think about being a journalist. So I always thought that it's very important to communicate with people. But then my life took another way, and I ended up being a doctor. And then years later, when we have this social media, this revolution in the world, then I realized that communicating with patients through social media would be something useful, something that could change lives, maybe. And then that's why I decided to talk to people online. So that's it.
That's awesome, and it's working out great for you. Your Instagram is blowing up, and that's amazing. You hold two PhDs and two MDs and a PhDs, right? What inspired you to go that far academically? Because a lot of time the doctors cannot wait to get out of medical school, right? It's a long process, and once they're done, they're like, I'm an MD. I know exactly what I want to do, and I'm done. Why did you pursue to keep going and keep studying more?
When I got a physician, well, first I was amazed by understanding how body works, and then I went to medical school, and I saw that medicine was more than that, because we could really change people's life. And then when I got my graduate, and then I was, well, I think I have to learn more. This is not enough. Like just being a doctor is not enough. This is something most of physicians think, because they go forward to specialty. And then, so that's what I did. I went to endocrinology. And then after that, I was still feeling that there was much more to learn in order to help people, because medicine is a science which is pretty big. It's large and it's profound. And then that's why I went through much more specializations to get all the knowledge that I could. And what I realized when I was on the top of everything like this was that all of this wouldn't mean anything if it couldn't be to help people. So I went back to, what does a doctor do? A doctor is here in this world to help people have health and well-being. So how can I connect the knowledge to results for people? And this is what I'm always trying to do in my life, is to use the medical information as a tool to help people. So connecting these two things, because people are on the other side. We, the physicians and researchers and these people, we are in this side, having the knowledge, and people are at the other side. So how to connect these two things? This is what I do for life. This is my motivation in life.
That's amazing. You worked at the NIH in the US, right? How was the experience working at the NIH? Did it change the way you look at medicine?
Yes, working at the NIH was an amazing experience, because I was already
For our I'm sorry to interrupt you, but for our listeners, can you explain a little bit what is NIH? What do they do?
Oh, yes. The NIH is the National Institutes of Health. It's in Bethesda, Maryland, in the United States. And it's a big center. It holds most of the genetics science in the US. So it's a very important center in medicine for the whole world. So people from the whole world goes there to learn and to improve knowledge in medicine. And then I was there when I was already an endocrinologist. And what I learned from there, that I took to my life, was how to connect genetics with disease, and how to make the knowledge in genetics to how to make it go to patients, like to better results, to improve their lives, in the context of endocrine diseases. I mean, because for us, for the doctors, genetics is normally something that it's in the books. It's something like very for research only. and it's not applicable. I mean, it doesn't go to help people. And what I saw the most at the NIH was how we can make it. How can we use the genetics knowledge into patients? So this was something important for me. I was studying endocrine diseases and correlations with genetics, and then how we design new treatments, how we can manage diseases, knowing better the genetics applied to this.
But you chose to be an endocrinologist. Why did you choose that specialization?
Okay, that's a great question because endocrinology is the specialty where we deal with hormonal problems, right? And hormones are molecules that circulate throughout the body, and they influence all our organs and tissues. So endocrinology actually encompasses the entire human organism. And I was really fascinated by this because when you see a dermatologist, for example, a dermatologist works with diseases in the skin. So they are trained to look at your skin. If you have something in your skin, you should go there, and this doctor is gonna help. Okay, a cardiologist goes to your heart and knows everything about your heart. Good too. But an endocrinologist goes to your whole body because hormones are everywhere. They are influencing all organs and systems. So the diseases, they involve the whole person. And then we need to understand the organism, like the whole body, in order to deal with these diseases. And on the top of that, we can, when we truly treat an endocrine disease, we manage everything because if everything is touched, and then you are able to fix everything. Like, not always we can fix everything, but I mean, it goes to the whole body, and this fascinates me.
Was there a patient or maybe a professor or a story while you were a student that inspired you to be like, well, I guess I'm trying to ask if there was like a defining moment where you're like, this is gonna be my specialization.
There were some points in my life, in my professional story, let's say. First, when I chose endocrinology, I was not, I didn't know very well this specialty. It was chosen like not very clear that this would be that I would be so in love with this specialty. So I got to my residency, and then it turned that my father became diabetic. So this was something important for me because I was able to understand what was happening with him and to treat him and to help him. So this was something important for me. Then a few years later, I had a patient that came to the hospital He was not my patient. He just came to the hospital with adrenal insufficiency, which is a life-threatening situation. And then he didn't have the diagnosis previously. He was being treated for another disease, mistreated actually. And then when I saw him and this diagnosis was established, then his life changed. He was completely, he became alive again. And this made me feel like, well, now I know why I'm here, why I'm doing this, because in that occasion, I was able to change somebody's life just because I was there to help him, and I had this knowledge, so this changed his life, and this was very meaningful for me. And then
Yeah. I can imagine. Like I've never saved a life, right? But I can imagine it must be a feeling that doctors cannot really explain in words, right? Like how do you put that in words?
uh, there are no words for this. And then something happened years later. So I have these three landmarks in my life. So I have a kid. My kid is now 8 years old. But when he was born, I was out from work to take care of him. And then when I got back to the hospital, um, there was a patient. He was an outpatient, okay? But he came and he was seen by other colleagues at the hospital. And he had Cushing's syndrome, which is a rare disease. It's an endocrine disease. And he had diabetes and other things like hypertension and things like that. And his diagnosis was of Cushing's syndrome, and the treatment proposed to him was, it's not possible to have surgery. We don't think this is a good idea for him, and we are taking him to chemotherapy and maybe radiotherapy. And then I just came, and it was my first day back, and he was not treated yet, but it was highly discussed with many physicians from many specialties, and they were decided on what to do. But they asked me if I could say anything, if I would maybe help somehow in if this was really the best way for him or not. And then when I saw everything, and I heard about all his medical history and everything, and I talked to him, and I saw the patient, and after seeing everything, I told him I thought that this was not the best way, and he could be operated on. And it was not something like very clear, okay, it's like this or it's like that. No, people were just saying, come on, a surgery here is not going to cure him. But I thought there was this way up. And I told him, and I said, it's your decision, but if you were my father, I would say to go to surgery. He went to surgery and he got cured from the disease. And this
And
was
this
some.
was in Brazil.
Huh? I'm sorry.
This was in Brazil.
Yes, here in Brasília. Yes, it was here. And then, so there are things that change our perspective. I mean, I was there just to I was not deciding anything. I was just saying my opinion. And then with this, his life was changed. So this again told me, you can use medicine and your knowledge as a tool to change lives.
So, in your view, what is the most overlooked aspect of diabetes or endocrine diseases?
Every single patient is unique, because I think most of the times we, the physicians, we are very scientific. We are very committed with updated and scientific information, and with treating our patients accordingly. And I think this is really good. Yes, this is very important, but this is not enough. I think the art of medicine is to translate scientific knowledge into real benefit to the single person that is in front of you. Because each patient is unique. There is no one equal to another. There's always something, like, even if it's just a detail, but there is something that is unique in everyone. So I think we forget this when we are practicing medicine. We think that, oh, there is something that is good, a medication or a treatment, whatever, and then we think this can go to everyone. So I think this is something that is this maybe in part can explain why many patients with diabetes, for example, although being followed by doctors, by good doctors, but they still cannot control glucose levels, because there is we are not looking to an individualized practice. I mean, each one is one.
Yeah, I think a lot of doctors say that we're trying to fix the disease, not the patient, right? But if we focus on the patient, the disease will go away itself. What frustrates you about the current medical practices, or even like the healthcare system in general?
Well, yes, I think now what frustrates me the most is about diabetes. There are now worldwide over 500 million people with diabetes. Yes, in Brazil, we have over 16 million people with diabetes. If we talk about obesity, it's 1 billion people around the world. So it's a lot of people. And we are not providing access to healthcare for most of these patients. So they are at risk of so many complications, as cardiovascular disease and what else. So I think this is something that frustrates me, because I think we can make it better if we have more physicians and health professionals well trained and truly involved in promoting this individualized care. Because as I was saying, each person is one person. And if we just look at the disease, as you said, and if we look at the patients as a group, I mean, so this is good for people with this disease. Like, this is good to control diabetes, to control glucose levels. And then you cannot get the results from one by one of your patients, because each one is one. So there is someone who have a lifestyle that matches with some recommendations, but other person has a lifestyle, culture, and habits that will not match with that recommendation. So this goes to every single disease and condition, especially the chronic diseases like diabetes. So if we have more physicians and health professionals trained for that, I think we can make it much better than we are doing now.
Yeah. For example, I was born and raised in India, and if doctor told some Indian person that you need to eat a lot of meat, it won't work because half the population doesn't eat meat at all. So like this idea that if you don't know the culture, you cannot, help someone, right? But you touch on a very important point that the system lacks professionals. But let's put that aside for a second. Is there ways a patient can prevent diabetes or obesity, or like what are the lifestyle changes an average person can make to prevent these diseases themselves?
Many things people can do to prevent and to help treating their diseases, like diabetes. And then let's see, let me tell some good tips like that work pretty well, and it's not something like extraordinary or completely different from what you do in your life. So first of all, sleep well. People who sleep from 7 to 9 hours per night have less pre-diabetes, less diabetes, and in people who are already sick, they control better glycemic levels if they sleep well. And it's not only the time in hours, the duration of sleep. No, it's about the quality of your sleep. And if you go to bed earlier and you wake up earlier, it also works better. So first of all, it's something so essential. It's to sleep. So sleep better, and your health is gonna be better. Second, take care of your mind. Take care of your mind, because everything comes from there. Stress is something that puts your glucose levels up, even if you don't eat. If you're stressed, if you have anxiety, your glucose levels tend to go up. So if you have a mind that is stable, then if you can manage your stress moments, because we cannot get rid of them. Stress are coming, but how do you deal with them? So if you have your mind like set it up to not go intensely through stressors in your life, this is going to help you a lot, a lot. And then third, I have one third tip. Try to be natural. Try to be natural as possible. What do I mean with this? I mean, try to eat more healthy food, less industrialized food, processed food. Try to walk instead of using a car, driving a car. Try to do things by yourself instead of asking somebody else to do. So this makes your life, your health much better. And I didn't say, oh, stop eating sweets, stop with carbs. Know this, you are prohibited of that. I didn't say. Why didn't I say? I didn't say because you don't need to do that. And you are not supposed to do that. Because every time you are prohibited of something, your body is under stress. And my second tip was to deal with your stress. So one go with another. And then,
Yeah, you cannot try to prevent yourself from eating so many things and then expect your body to be not stressed, right? They both will not work hand. Yeah.
that's right. So this is one reason for not prohibiting anything. And what we see is that people think they should be prohibited. Most of the times when we say, okay, so you do have diabetes. And then the first question is, oh, doc, so then from now on, I cannot have a sweet, right? And most of the doctors say, right. But it's not.
Let's talk about myth, the misinformation. So, what's one common myth about food or hormones or metabolism you wish people would not believe? Anything that comes to your mind?
The most important of them. So people with diabetes cannot eat sweets. I think this is the number one.
But doesn't I'm sorry, I just want to touch on that one. But doesn't this like so when you're diabetic, your body doesn't, make insulin. Doesn't eating sugar make it bad for your body in that situation when your body is not making insulin?
Okay, actually your body is making insulin, but the insulin is not able of doing its job correctly. Okay. Okay, so this is true that insulin, what does insulin do? Insulin takes the glucose in the blood and puts it into the organs. If insulin cannot make this job correctly, then what happens? Glucose goes up in the blood because it's not going to the organs. That's what insulin does. It puts the glucose inside the organs. So glucose leaves the blood. And then if insulin doesn't work well, this doesn't go, glucose goes up. Okay, but glucose is our fuel. It's important for the organs. So glucose is supposed to go into the organs. So we need glucose. Okay. So we gotta deal with this, right? But our bodies is supposed to get glucose and put the glucose to the organs. All right. When you eat a sweet, what happens is that the glucose in the sweet is gonna be absorbed very rapidly and then goes up in the blood. So this is gonna make the insulin's work harder, because if this process occurs rapidly, other food will also, other carbs and other food will make glucose to enter. And this is how our body works. Our body works with glucose, but if it comes like slowly, it's easier to insulin to work. And when we have a sweet, this glucose goes up rapidly. And this is what is more difficult. It's harder to insulin to put it into the organs. Okay, so if you eat sugar, sweets, constantly, routinely, then this will make your diabetes under control. It makes sense. Okay. So if you reduce the amounts, if you reduce the ingestion of sweets, it makes easier. If you take off all sweets, then it's going to be easier to control diabetes. That's true. The problem is, if you take out sweets, then you get stressed because you were prohibited of something you love and you were used your whole life to have it. Then you have stress. And when you have stress, your hormone levels like cortisol, catecholamines, and other hormones goes up because you are stressed. And then these hormones, they interfere with insulin action. So your body is always dealing with glucose and insulin is working and everything. If you eat sweets, this work is harder. If you don't eat sweets, this work is easier. But it's happening. It's there because you are being fed by other components and everything is working. But then if this is a person who was prohibited on sweets, then what happens? No sweets, good, but hormones coming from stress giving you a problem again. So it doesn't work at the end. And then, so that's why I say that you should not stop completely, because you should not be prohibited. If you want to stop, if this is your decision, it's good for you. Okay, you don't eat sweets. Okay, and if you stop them, good. But if this is your choice, if this is not something that will make you feel bad inside, in your heart, because if you do, then it doesn't work. And then what is my proposal is that, what do? You reduce sweets, but you put other food, good food, healthy food that helps your gut to slow down the absorption of glucose from sweets. So, for example, if you have your stomach empty and you go and you have a sweet, a chocolate, what happens? Your gut is gonna absorb quickly because it's gonna be digested and quickly absorbed, and then glucose levels up. But if before you have this chocolate, you have some healthy food, for example, you have a salad, or you have lunch with vegetables, fruits, a source of protein, for example, and then you have your chocolate as dessert. Then in your stomach and gut, your digestion is going to be slower, and then the absorption of glucose is going to be slower. This helps your body to deal with the glucose.
Yeah, it just won't be like a spike up, right? Because your body is absorbing it.
The famous glucose spikes. If you deal with these glucose spikes, your life gets better. Your health gets better. And you don't have the stress factor, which is, it's terrible, because what can you do? What can you do if you are continuously being stressed? So it's very easy to say, okay, don't get stressed. Come on. If you say you are prohibited of something, if you're prohibited, you're going to get stressed. So that's how. And then there is something important to say. Glucose control is not something, it doesn't mean that you have to have your glucose levels 100% of the time under control. It's not like this. Because we are not able of managing like this. And it's not necessary, because if sometimes it goes a little up, but in the meantime, we have glucose in good levels, then it's fine, it's okay, it's enough. Because many people get crazy, like, oh, come on, I gotta measure my glucose levels every time. I gotta check, or using a CGM or something like that, just to make it, oh, come on, it cannot go up even one time. We don't need this. And again, this is also something stressful. So to get protected, you need means of glucose levels controlled.
Got it. Let's talk about being a doctor. It's such a demanding profession. What has been the hardest part of your profession so far?
The hardest part, I think, it's to connect people with the right information, with the correct information about how to deal and to treat their diseases. I think we have this gap between knowledge and people. So scientific knowledge, is not supposed to be as scientific, is not supposed to go to people, okay? But it's supposed to be translated in order to make people's life better. And I think this is the most hard thing. So yeah.
But you're doing really good with that, because like on your Instagram reels, you're trying to explain these complicated things in 60 seconds, right? That's what an average person need. Like if somebody is not a doctor and they don't care about research, they're not gonna go read a research paper you published, right? But they will definitely learn something from maybe a 1 hour podcast like this, or a 60-second quick video about it's okay to have sweets, like you said, right? Yeah. Awesome. So after so many years of being a doctor, what keeps you inspired to continue? I mean, I understand this is great work, but is there something more to that?
Yes, I think what keeps me doing what I do is to see the results, because every single person who comes living happy and having fun in life because of changes that came from uh, healthy a healthy movement that started from me. It's amazing. And this is not, I'm not talking about the patients I see directly, because they are not so many. I cannot see many patients, but from patients that are seen from the doctors I teach, and people who see me on Instagram and internet and media, because this makes me feel like I'm 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 helping to transform people's life somehow. So I'm on I'm up hills. I'm just because uh, I see that I can do it much more, and everything I do, I see I can do more.
Going.
So I think that's it.
Okay. So, doctor, tell us, how do you balance research, teaching, and seeing patients day to day? Because that's a lot, right?
Yeah, that's a lot, but I love everything I do. So I just um, I don't do much of any of these ones. I mean, I go so I in the morning on Monday I am at the hospital. In the afternoon I go to the private clinics and things like that, and then I have my agenda like distributed, and the weekends are for family, as I am a mother and I have a family, so I take weekends for my personal life, and during the week I am switching from here to there, and it goes pretty well. It's not a lot. It's not a lot. Just it's not just because I really enjoy, and and I am very I have a discipline on that I don't let anything take me more than what I was proposed to. So I try to what I am intended to. I mean, so in private clinics, I go, I see patients in the private clinic, but it's only once a week. Then so I can manage everything. So I can do few of anything during my week.
That's awesome. Is there a new technology or treatment in endocrinology that excites you these days?
Yes, I'm excited on weight loss treatment, and I'm not excited as most of people are. I mean, wow! Now we have this drug that can make you lose weight. I'm excited because we didn't have drugs that could make what the new drugs do now. So we do have very kind of revolutionary drugs because they do what no other drug could do before. So this is amazing. But obesity is a chronic disease, and it cannot be managed by one drug. So I'm amazed because now we do have a tool that can be molded, or can be like transformed, and then this can help people. But not that this is going to be the solution, because it's not. But to have this tool that is really powerful, and to manage it and to find the right place for it, is something really amazing and fascinating. So I don't know, I'm not sure if I was clear, but
No, I see what you mean. It does make sense. Can you name any drug that is recent and it's new and it's really exciting to you?
we do have semaglutide, Wegovy. We have tirzepatide, which is Mounjaro, and we have other ones that are being in study, and they are probably coming soon. But the thing is, these drugs, they have made a boom all over the world, and I'm not excited on this boom, but I'm excited on the opportunity to find a way to help people losing weight. And this is a tool that will help. So I'm amazed on the understanding on where are we putting these drugs, what is going to be the right place for them in order to help people lose weight and keep in a good shape and everything else. So this is something I cannot say, I don't care. I do care, and it's amazing, and I recognize that, but in another way, not in the way people are saying, oh, come on, now we have the magic solution for everything.
There is no magic, right? You gotta put in the hard work.
But they are too, and they are a nice tool that never came before. So this is amazing.
Okay, we have a question from our YouTube channel member side. Is it true that intermittent fasting can reverse prediabetes?
Yes, it's true. It's true. And uh, not only intermittent fasting, but also other strategies can do this because prediabetes is a reversible condition. So the answer is yes. You can make it. If you change your lifestyle, you can reverse prediabetes. Yes.
Okay. I have few rapid fire questions. These are a little bit about you, little about medicine, but you can just answer them in like one word, very short, quick, whatever comes to mind. We don't have to think about these, right? Okay. So first one, coffee or tea?
Tea.
Okay. One book that changed your perspective as a doctor.
The Power of Now.
Wow. Who is it by? Do you remember?
Oh my gosh.
It's okay. We'll find it and put it in the show notes. Don't worry about it.
Okay.
I am.
Yeah, I cannot remember because
That's fine. Don't worry about it. The name
by
sounds
heart I
exciting.
don't remember.
It's okay. Are you a night owl or early bird?
Early bird.
If you were not a doctor, what do you think you would be?
A journalist or a diplomat.
Oh, a diplomat. Interesting.
Yeah.
Oh, negotiating peace deals with other countries. That'd be fun.
Yeah.
Your favorite medical TV show or movie, even if it is in Portuguese, that's fine.
I was. There are a few ones, but I think I would say Patch Adams.
Okay.
Patch Adams.
What is the strangest health myth you've heard from a patient?
Sometimes I hear weird things. Mango with milk is poison.
Wait, really?
Yeah, this is a Brazilian myth. Yeah.
Oh my God, I grew up drinking mango shake my entire life. So I was a kid. We would
You
take
wouldn't
like
be here.
I wouldn't be here. If you're Brazilian, it's okay to drink mango and milk together. I'm a living proof of that, everyone. Okay. One habit you wish every person would adopt for better health. Just one habit.
To drink water first thing in the morning.
Is there a difference if you drink cold water, room temperature, or hot water when you wake up? Or it doesn't matter?
It doesn't matter.
Okay. Just drinking water. Okay.
Yeah.
What is the most underrated healthy food in your opinion?
Rice and beans. Rice
Wow.
and beans. Yeah, the typical Brazilian food, like for lunch. And people think this is not healthy, and especially when they discover diabetes or something, they think they cannot eat, especially rice, but also beans, and they think they should cut these things, and they are very...
Okay. Let's go a little sci-fi. What is one medical invention you wish existed?
Well, this is maybe okay, a pill to slow down people's mind.
Oh wow, that'd be amazing. Everybody would have such a good sleep, right?
Yeah, that's true.
Because I have these situations sometimes, not that bad, but like I cannot shut off my brain. I just can't sleep because I'm constantly thinking everything at the same time, right? Yeah. No, but that's exciting. Yeah, if there was a pill and it just, you know what, there is a pill. It's called smoking a joint. You know, a lot of people tell me that. I've never smoked one, but a lot of people tell me that, like, if you roll a joint, it's just chill. You just want to, you know, relax. But who knows?
Well, come on. Yeah.
Yeah, let's not promote, let's not promote drugs. Yeah. One thing you do every day that keeps you grounded, that keeps you humble.
I meditate in the morning, briefly, like
Beautiful.
something like 3 minutes, but I do every morning.
So you're saying just putting in 3 minutes makes a big difference for you?
Yes, it does. It makes a difference, and it's something like when I started to train on this, and then come on, your energy is completely different after 3 minutes.
What is the, sorry, what's the biggest misconception people have about doctors?
Ah, that we can restore their health. I mean, that we can uh, cure their diseases. We cannot. We can just help. We are just facilitators. We can just help them, but they are the ones who cure themselves. So they think they put things on us,
Right.
and it's not like that.
You have 1 year to go practice in any country you want to go to. What country would you pick?
France.
France.
Yes.
Interesting. Okay. What is your go-to stress relief strategy after a long day at work?
At the end of the day, I like a warm shower, and
Yeah.
I lay on the bed and I meditate. But now for 20 minutes or 30 minutes
Yeah.
or so.
Yeah, because you had a long day. Going back to your younger days, what is the toughest exam you ever took in your career?
I think most of them were challenging, although uh, I was kind of very successful on my exams in general. But if I should choose one, right, I should choose one. The one to obtain the title of specialist in endocrinology, maybe.
Yeah. Okay. Last question. If you could give your younger self one piece of advice before medical school, what would it be?
I think I should say to myself, don't worry. Everything in life has its time. I think I should say, no rush, no need to rush. Maybe this.
Yeah. Yeah. There was a doctor I interviewed about a month and a half ago, and she recommended her favorite book of all time was The Subtle Art of Not Giving a Fuck by Mark Manson. I think it's just basically what you said. Don't worry. Just don't care too much. It's gonna be okay. Awesome. Where do you want to send our listeners who are listening in or watching this episode? Where should they go follow you? Where are you most active?
Oh, I am on Instagram at DRA Monalisa Azivado _ and I'm at YouTube, Dr. Monalisa Azivado. I'm on TikTok too. Yes.
Oh yeah. Do you post like dance videos on TikTok?
Oh no.
No? Okay. We will find all your socials and link it in the show notes. I also see you have a website where you provide a lot of information.
Oh yes.
Yeah, we will put all that in the show notes below so everybody will be able to find you. But any last word?
On TikTok, I just entered recently.
Okay.
So, but I have 60K
followers. Oh, that's awesome. Yeah, you're gonna be great. That's awesome. Last words. Is there anything you want to tell to our viewers, listeners? Anything you want to say?
I would say that take the responsibility to yourself about your health. It's gonna make things much easier if you take the responsibility to you. And then there are many people and tools to help you, but the final result is with you. So it depends on you. It's up to you.
Awesome. Well, thank you so much for doing this, doctor. I'm really glad we did. You have a good rest of your day.
Thank you.
Yeah.
You too, Mohit. Thanks a
Bye.
lot. It was a pleasure to be here. Bye bye.
Absolutely.